My name is Dr. Mbithi Doris. I'm a gynecologist, obstetrician gynecologist, currently working at the County Referral Hospital in Makueni. Today I want to speak about human papillomavirus vaccine. It's important to note that human papillomavirus is the type of virus that causes cervical cancer. And we know in our country cervical cancer is the leading killer of women, causing about 9 deaths every day in this country and causing more than 5,000 cases of cervical cancer annually in our country. So these are not very good statistics. These women who get this cancer are women in their productive years, and most of the times they will present to the hospitals when the cancer is advanced and very little can be done to remedy the situation. So it is important to prevent this cancer from occurring. So in the previous videos, I discussed about prevention, and the most important aspects of prevention, one is the immunization against human papillomavirus, and the other one is regular screening as prescribed or as scheduled by your healthcare providers. So with immunization, we are targeting the human papilloma virus, targeting girls before they start engaging in sex, because at that time they have not gotten the infection with the human papilloma virus. So it's good to know a bit about human papilloma virus. It is has so many types, but the types that cause harm in human beings are few. There are about 14 types that will cause cancer. And the commonest that cause, the types that cause the highest number of cancers are HPV 16 and type 18. These ones will cause 70% of cervical cancer. So then the other types that cause warts, 6 and 11 cause warts, 90% of warts. So they are viruses that can be prevented through the immunization using the human papillomavirus vaccine. So it is very important to also note that most of the people who get this infection will end up clearing it on their own without any treatment or anything. There's actually no treatment for the human papillomavirus infection itself. 90% of the people will clear. A few people will get persistent infections, and it is these ones who get persistent infections who will end up with cervical cancer or the precancer changes that can lead to cervical cancer. So, and the important thing about this is that this can take so many years, 10, 15, up to 20 years for some people to get the cancer. And these infections are not symptomatic. So when you have the infection, you don't get any symptoms. Until now you develop cancer, that is when you start developing symptoms. So that is why it is very important to check, to have regular screening so that you're able to pick precancer lesions that can be treated, and then you prevent the cancer from developing. Human papillomavirus also causes other types of cancers. It causes vaginal cancer. It causes anal cancer in both men and women, and it can cause oral or mouth cancer or oropharyngeal cancer, and it can also cause penile cancer in men. So it causes a lot of diseases, cancers and warts that I have said are due to type 6 and 11. So how do we prevent this infection? I have said there are 2 ways. So today we'll discuss more on the vaccination. So the vaccine that we have, there are 3 types of vaccines. We have Gardasil that protects against 4 types. We have Gardasil 9 that will protect against 9 types. Then you have Savirus, which will protect against 2 types. But the type that we have in our country is Gardasil. Gardasil protects against type 6, 11, 16 and 18. And 16 and 18 causes 70% of cases of cervical cancer. So if we take this vaccine, then we'll reduce cervical cancer cases by like 70%. So these 2 types of vaccines, when are they given? The ministry has given guidelines that we should give these vaccines to girls who are between 10 to 14 years. This is the priority group that we want them to be given the vaccine before sexual debut. Because when they get the vaccine before sexual debut and when they are young, then their immunity is stronger. They mount a stronger immunity against this infection. So it is important to note the age. And then the vaccine is usually available in the normal vaccination program, the place where you get vaccines for your children, the babies. It's the same place where you get the human papillomavirus vaccine. So it is important to get. It's usually given 2 doses, one, and then after 6 months you get a second dose. So the sad part is that despite having the vaccine in our country since 2019, only about 2 out of 10 girls have received the 2 doses of the vaccine. And this is not a good news, because we know this cancer is preventable and the vaccine is available at no cost in the public hospitals. So let us at least make sure that we if you have girls in your home, or you have your neighbors, or you have your friends, tell them to take them for vaccination, because the vaccination is available. When we look at vaccines, how do they work? When you're given an injection, your body senses like you've gotten an infection with that virus. So when it senses that, your immune system mounts an immune reaction that will now develop protection against that infection. So you'll find that once the vaccine has been given, you develop the immunity. So later, when you're exposed to the same types of viruses that you have been vaccinated against, then you already have immunity. Your body remembers. It has a memory of that. So then it will just mount an immune reaction, and you'll be protected from getting that infection, as compared to if you get the infection and you had not been vaccinated. So it is important, because to understand that this human papillomavirus is just a continuation of the vaccination program. We have many vaccines in the public hospitals, and many vaccines in the public and private, and we have many vaccines in our immunization program, and we have been using them for long. We have all these vaccines that we are giving to children: polio, measles, rotavirus, influenza vaccine, hepatitis vaccine. So all these vaccines have been developed to counter the diseases that occur as a result of infections with these viruses. And the reason is, if you look at a while back, you would find that we used to have outbreaks caused by these viruses. So you could have like a measles outbreak, polio happening, causing a lot of paralysis. And because of the high numbers of deaths and complications that could arise because of those viral infections, then vaccines were developed. And those vaccines have reduced significantly. And in some cases, they have eliminated the disease completely. But the vaccination still continues. So what that tells us is, vaccines are important if we are going to eliminate cervical cancer as a public health problem. It is rare nowadays to hear of cases of measles in our country, because our children are vaccinated, like more than 90% are vaccinated. It is rare to hear of a case of polio. They are vaccinated. Smallpox, rotavirus, you have vaccinations against this. So the outbreaks are very few, and some of the diseases have been eliminated. So human papillomavirus vaccine is not any different. It has been developed to counter now the effects of the human papillomavirus infection. And it is one of the vaccines that has gone through the rigorous process of development. It has been tested. It has gone through all the clinical trials to make sure that it is safe. It is mounting the right kind of immunity, and it is of quality, and it can be used by human beings. So it is a safe vaccine. When you look at the preservatives, the adjuvants that are used to package this vaccine, they are not any different from what we are using for the other vaccines. So it is not something that has just fallen from somewhere, like now we have just brought this so that we cause harm on the women. It is not true. So it is a vaccine that is safe. Then when you look at when you're given this vaccine, what are some of the side effects that you can get? They are not any different from the side effects you'll get, or the reactions you'll get with the other vaccines. So you'll get some pain on the injection site, you get some inflammation or swelling, and then you can find the place is red. So there's some redness. So those are the common of the side effects that you can get. These ones don't even need any medication to manage, because they are not serious kind of side effects. There are some cases of fainting that have been reported, and there are some cases of dizziness, but they are not of any serious alarm to these girls, because some of them are very rare and they are conditions that are manageable. So this is a vaccine that is safe and it is regarded as such, and you should not be worried as a mother to take your daughter for the vaccination. It is important to have this. So there's some people who worry about if you give a girl who is 10 to 14 and you tell them that this vaccine is protecting them from human papilloma virus, which is sexually transmitted, are you giving them a license to start having sex? And this is not the case. There are studies that have been done comparing girls who have received the vaccine and girls who have not received the vaccine, and their sexual behavior is not any different. So this vaccine is not going to sensitize your girls to start having sex. They will have sex, their sexual habits will not be any different from those girls who are not vaccinated. So it is a vaccine that we should embrace and make sure that at least 90% of the girls who are eligible for this vaccine have received it, so that at the end of the day, we will reduce significantly the number of cases of cervical cancer we have and reduce the deaths that we are getting from cervical cancer. Now, the other question is, some people will ask, if you have this vaccine, will you still have to go through screening? Because since it started, you can see some girls will have grown out to the age maybe where they need to be screened or something like that. So screening continues, and screening schedule is unchanged by the fact that you have received the vaccine. Although there are some studies that have shown that those who have received the vaccine, when they are followed up, most of them will not have any precancer lesions from these viruses and the cancer cases. But because the types we are protecting are 2, and I said there are many, we need to continue with a regular screening program so that in case there is any precancer, you are managed before you develop the overt cancer, cervical cancer. So it is a vaccine that I hope I have convinced you that the vaccine is safe. It is effective in preventing human papillomavirus infection, precancer, and cancer, and it is available. It is at no cost in public hospitals. In private hospitals, there is a cost, but there are some people who can be able to manage that. So it is a vaccine that we should ensure that every girl 10 to 14 years has received it, so that in this country we markedly reduce the cases of cervical cancer and the deaths of women because of cervical cancer. If you have any questions, post them in the comment section. I'll respond to them. Thank you very much.